Good afternoon and good evening to every one of you, wherever you are from all over the world. So I am live from Jakarta, Indonesia. How are you all today? While we are going to wait for Dr. Joel Cohen to join us, so let me first introduce myself. Hi, Dr. Joel Cohen. So he is here now. Hello. So I'm going to invite Dr. Cohen with us. Okay. Morning, Dr. Joel Cohen. How are you? So we are waiting for Dr. Cohen to live. Hi, how are you?
Nice to see you.
Nice to see you. Good morning.
Good morning.
You look so fresh.
Just woke up. I'm all good.
Okay, okay. So, Dr. Cohen, before we start with our topic tonight, so I'm very excited. We are going to talk about filler nodules. It is a very, very interesting topic. And let me say hello to everyone who has joined us tonight and this morning in your time. So, let me first introduce myself. Oh, I'm very excited, Dr. Joel Cohen. You don't know how I feel honored and happy to be able to host you. And my name is Inneke Jane Hidayat. You can call me by Jane. I am from Jakarta, Indonesia. I'm a dermatologist, and thank you for the Euromedicom for organizing this for us. And let me introduce you a little bit to our attendees here. So Dr. Joel Cohen is an internationally recognized expert on aesthetic dermatology and skin cancer and dermatologic surgery. And you are board certified by the American Board of Dermatology and fellowship trained in aesthetic dermatology and Mohs surgery. And you have published at least 260 journals, scientific articles, and written book chapters, and co-authored in 3 textbooks. Am I right? And you received a lot of awards, and I was like, oh my God, I am hosting a superstar tonight.
Your name is well all over the place, and I congratulate you for all your academic hard work. And it's an honor to be on with you this morning live or this evening in Jakarta.
Yeah, and Dr. Cohen, you also appeared on many TV shows, such as The Doctors. It's a reality show, I think, about people having surgery and sort of things.
Yes.
Mm-hmm. And Dr. Joel Cohen is also elected to the Aesthetic Multi-Specialty Society, which is also organized by the Euromedicom. Okay, so do you want to add anything more?
Yeah, I'm thrilled to be here. One of my areas of interest has been really fillers and lasers and botulinum.
Mm-hmm.
So I've written a lot about that. And when
Yes.
the invitation to talk about filler nodules, I think the timing is really appropriate because
Mm-hmm.
we're getting a lot of questions about it. The Moderna vaccine had 2 patients that had a history of fillers that had facial swelling. The
Mm-hmm.
3rd patient that was rather ambiguous that had lip swelling
Yes.
after COVID vaccine. And that sounds a little tough to characterize because that patient actually had the same type of reaction after they had the flu vaccine
Mm-hmm.
before. So, since those 2 cases, there's been a lot of press about that. And I think when there's an opportunity to blow something up in terms of, headlines, the press
Mm-hmm.
that. And I just want to compliment Jolene Edgar from Allure magazine, who really did the most thorough and comprehensive analysis of really what was going on and
Mm-hmm.
interviewed me as well as several other experts. And, this is, first of all, very, very, very rare. 2 patients,
Mm-hmm.
a trial of 30,000 patients, 15,000 who got active
Mm-hmm.
vaccine, very rare. Since that report, there's been a couple patients who have had this just in the community from not only Moderna, but the Pfizer vaccine.
Mm-hmm.
And secondly, again, this is not something we haven't seen with other vaccines. I
Mm-hmm.
myself have taken care of a patient who had this sort of immunologic
Mm-hmm.
up after the shingles vaccine. I alluded
Mm-hmm.
to the lip patient who had it after the flu vaccine. It's been seen after the pneumococcal vaccine. So first of all, with vaccines in general, the immune system is triggered. And
Mm-hmm. Mm-hmm.
immune system, you're actually trying to get an antibody response to protect you against whatever is being vaccinated for. But secondly, there are non-specific areas which can react, and we call
Mm-hmm.
this reactivity. So, for everybody who's had a vaccine before, I had the 2 Moderna vaccines. I had pretty significant arm discomfort and I had redness. That's called local reactogenicity. So arm pain, arm swelling, arm redness is local. And then
Mm-hmm.
when people have a flu or a headache or just general aches and pains and they don't
Mm-hmm.
feel well, that's systemic reactogenicity.
Mm-hmm.
So we do know that after the second vaccine, the reactogenicity is actually higher, and that's been
Mm-hmm.
found. More people complain of either locally more arm pain or more arm redness, or systemically they complain of more flu-like illness or general malaise. And that's important to realize with these types of situations as well. There is an immune kick-up, and
Mm-hmm.
that immune kick-up we've actually seen even for people who have viruses. I've
Mm-hmm.
seen patients who've had the flu and reacted on the face. And we've even seen it after people have dental procedures. So it is something that we are accustomed to seeing. There's nothing new here. And it's very rare. It's mild. It's totally treatable with over-the-counter things like antihistamines in most cases.
Mm-hmm.
In some cases, some patients may need a prescription medication, and hopefully you're seeing a doctor for your treatments in the first place, and they can recommend that to you.
Mm-hmm. So, have you got vaccinated already?
Yes.
Because yeah, okay. So because in Indonesia, we for the medical personnel, we have been vaccinated, and we are using the Sinovac once. And up to now, from what I have observed, there were no report cases of swelling or inflammatory reactions on the injected areas of fillers. And I am quite surprised, and it is something like what to say, something that is quite an insight that in some filler injected areas, the vaccine can induce the swelling. So um, out of the reported cases like swelling on the lips and also the periorbital, which I read from the published reports, are there how many cases reported of the vaccine induced inflammatory reactions?
So for the Moderna trial, there were only
Mm-hmm.
two. Since then, there's been a few in different communities in the
Mm-hmm.
U.S.
Mm-hmm.
and for both Moderna and Pfizer,
Mm-hmm.
but only been a few. And as I said, this is not something specific to the COVID vaccines. We've
Okay.
seen it with viruses, and we've seen it with dental procedures. So I think the message is really what that Allure magazine article came through with, and you can find it online, is that this is extremely rare. It's not something new specific to COVID. It's treatable, and very often it just goes away on its own in a day or two, but it can be treated. As far
Mm-hmm.
as treatment, I mentioned, but there are some reports of using ACE inhibitors like lisinopril.
Mm-hmm.
Spike protein interacts with the skin and the ACE receptor. So ACE inhibitors have been thought to be helpful. And in actual fact, the steroids that have been given were given in such low dose. We're talking about patients who might get 20 milligrams or so of prednisone. And, people have said, is that something that could block the immune reaction to having the COVID vaccine? And the answer across the board, from infectious disease experts to other experts in terms of vaccines and people who regularly put people on systemic steroids, including dermatologists and rheumatologists, that's a very small dose, and it does not blunt the immune
Mm-hmm.
response to the COVID vaccine.
Okay, so when we are talking about filler nodules, Some actually divided it into the early onset and late onset. So, do we still use that term, according to the report of the vaccine related, or what people trying to relate it to the vaccine? So, I suppose that those are early onsets.
So, first, I myself have written several articles and chapters about filler nodules,
Mm-hmm,
and I must confess that we use a different definition
mm-hmm,
sometimes between what's early and what's late.
mm-hmm,
So, rather than put an arbitrary time frame, I think it's important to point out that, sometimes when you place filler material, right away, something may actually happen. So you and I commonly inject patients. We inject 15 plus patients a day with different injectables.
mm-hmm,
And it's very common for us to use a filler and for somebody to have a small bruise at an area where we inject, particularly the oral commissure marionette
mm-hmm,
area or under the eye. So
mm-hmm,
bruising can happen, swelling can definitely happen. So when you're having a needle put in the skin, whether it's a needle with the syringe attached to it or a needle to introduce a blunt tip cannula, you can actually cause the bruise and you can actually cause swelling. And so, in general, I tell patients, don't work out the day of the treatment and probably the day afterwards. And if you're not having, any significant bruising or swelling, then on day 2, you can go out, and do your thing, but don't be surprised if you actually, you know, have some bruising and have some swelling.
mm-hmm,
Sometimes we
mm-hmm,
see more swelling with salty foods. Sometimes we actually see swelling if we've placed filler such as below the eye and we've
mm-hmm,
done botulinum toxin, Dysport, Botox, Xeomin, Jeuveau, what have you, in the area, then there's less muscle activity to
mm-hmm,
pump away the swelling. So bruising and swelling are very common. When people do get a bump, if that bump occurs right after the injection, it's probably related to, as just the fact that there is a aliquot of product that is
mm-hmm,
there that sometimes we just need to massage or mold out,
mm-hmm,
or sometimes, muscle can mechanically contract. So the
mm-hmm,
depressor anguli oris and the depressor labii inferioris can cause that. But if filler has been placed and it's quiescent, everything is well placed, it looks
mm-hmm,
good, patients are happy with it, whether
mm-hmm,
it's 2 weeks later, 4 weeks later, 6 weeks later, that's really a delayed nodule if something occurs.
mm-hmm,
And, that could be an infection. And if it's an,
mm-hmm,
usually it would be red, it would be tender. It usually wouldn't be in multiple areas or multifocal.
mm-hmm,
And, it would be pretty indurated, and when you press on it, you could actually
mm-hmm,
feel that warmth, and patients will have tenderness, and then you'll blanch out that redness. And that's not that common, but we do see it. And if it occurs weeks afterwards, it's probably not the prep that the physician used to inject the person, or, a patient touching the area, because
mm-hmm,
everything was good for weeks, right? So it's probably some sort of thing going on. And what has been found, that when people have their teeth cleaned, there is a certain level of bacteria that gets into the bloodstream. And sometimes
mm-hmm,
that can actually, the proximity to the filler, a little bit
mm-hmm,
of that bacteria can attach itself, and it's called a biofilm.
mm-hmm, mm-hmm,
That happens. It's very rare, but we have ways to treat that. And sometimes we put people on antibiotics. But then there are people, as we're getting to, and we talked about, that have, filler that's well placed for weeks, and then all of a sudden, some areas that have filler light up. And we don't
mm-hmm,
exactly, know how often this happens. It's very rare,
mm-hmm,
but it has happened with other vaccines, and it has happened a few times with the COVID vaccine. It happens when people have the flu, and it happens when
mm-hmm,
people have a sinus infection. That's just sort of overall like immune stimulation, where the body has inflammation and you're out of equilibrium, is probably what's stirring that up. And interestingly, these aren't usually like red and hot and tender like an infection would be. It's just this non-specific swelling.
mm-hmm,
So I've seen this respond to antihistamines within, 12 hours and people get better. I've seen people take non-steroidal anti-inflammatory agents like ibuprofen and it gets better in several hours. And I've seen the couple cases that have been reported where lisinopril or prednisone is given and it responds as well. So I think all those are important to realize. There are things that happen right away and there are things that could happen in a delayed fashion. And, these are unusual and we have ways to treat it if they don't just go away on their own within a few days.
Okay, so I read your publications about the management of delayed inflammatory reactions or filler nodules, and I also contribute to the something like consensus on guidelines on how to treat delayed inflammatory reactions or filler nodules. There are some differences in treating or from the contributors on the consensus, like the usage of the hyaluronidase and corticosteroids. And according to what you have mentioned earlier, could you point out, like, if we find such cases, what would you, how would you treat the patients, like, for the initial treatments?
So, first of all, when you're writing a consensus and you're getting world experts together, if you have 10 experts in the room, they're not all going to agree on every step of the way because they have their individual experience to call on. Plus, if it was very clear cut, there would be a specific review article saying, there were multiple clinical trials that said this is the absolute way to go, A to B to C to D. When we have consensus statements, it means that there is checkers of data and from different areas and mostly just case reports, and people are there to talk about their experience. And with 10 people there, you may have 8 opinions, you may have 10 opinions, you may have 11 opinions. Somebody may actually change their mind after listening to somebody and the way that they present their information and the case they've treated. So first of all, there's been many consensus statements written about fillers. I'm the lead author for one of them about vascular compromise that was published in Aesthetic Surgical Journal, ASJ, a couple years ago. That was a multi-specialty article, and we talked about the use of hyaluronidase and how we pulse hyaluronidase. If you see somebody that looks like they're having necrosis, you use hyaluronidase. If it's HA filler, you repeat after 45 minutes or an hour. You use like 200 units, and then you put the patient on aspirin. You tap the area to try to facilitate vasodilation. And then some people in that article, like me, feel that you actually can benefit from using nitropaste. And there were a couple people who said, based on an animal study, I don't think I want to use nitropaste, but let's go down the algorithm, keep using the hyaluronidase, and then let's agree on other points, such as, possibly injecting other agents like low molecular weight heparin, or having the patient actually have hyperbaric oxygen therapy. So I think it's really important to realize that for the different types of things that we can encounter, typically there are reports in the journals about how to effectively treat it. And when it's something serious like impending necrosis, that's something where I think people should have protocols and supplies on hand to hopefully treat the patient right in front of them. In terms of other situations like nodules, this is not such a rush. There's no major urgency in most cases. A patient, may call and say, hey, you injected me with filler, 6 weeks ago. And since then I've had, a vaccine like the HPV vaccine or, the flu vaccine or pneumococcal or shingles or COVID vaccine. I had it yesterday and I'm noticing I have some facial swelling. Well, we tell the patient to come into the office and we'd evaluate them. If it's multifocal swelling and it's different areas, I'd say to the patient, let's take antihistamine, and let's see how things look. And I want you to take Claritin today and some Benadryl tonight. And then I'd like to see you tomorrow at the office. And if it's not getting better, then I would probably put the patient on 20 or 30 milligrams, depending on how bad it is and how big the
Mm-hmm.
patient is. I would put them on 20, 30 milligrams of prednisone for a few days
Mm-hmm.
and then taper it after a few days. And
Mm-hmm.
that usually will get the patient out of trouble. So in terms of other things that can be used, there are some reports of using colchicine. So we know that colchicine is a drug that inhibits microtubules and the way that cells
Mm-hmm.
divide. And it has long been used in rheumatology and internal medicine as an anti-inflammatory agent and specifically for gout.
Yeah.
So you can have patients take a pill, which is 0.6 milligrams, or two pills, every, take one in the morning and one at night. And I've seen actually where people have something that lasts a little bit longer and we want to use a anti-inflammatory agent. But we do actually have ways that we can inject these areas. So, I've injected areas not just with hyaluronidase very focally to dissolve a nodule, but I've injected areas with intralesional steroid. And we have to be
Mm-hmm.
careful the dosing that we use because we don't want to actually cause atrophy to the skin. So typically,
Mm-hmm.
I will do intralesional steroid, oftentimes with 5-FU, 5-fluorouracil. And
Mm-hmm.
interesting, that 5 is something that you really have to talk to the patient. Our
Mm-hmm.
patient we see for fillers in general are of childbearing potential, and 5-FU is pregnancy category X. So if a
Mm-hmm.
woman is pregnant, planning pregnancy, or nursing, I will not use 5-FU, and I'll just stick to steroids intralesionally alone.
Mm-hmm. So I want to show the attendees the algorithm that you've written with other panelists. Oh, but I couldn't show it like it has to be like uh, left to right. So this is one of the publication that you have written with the other panelists about the usage of corticosteroids and then hyaluronidase, including the 5-FU. So I think for all the attendees, it is very good to try to look it through PubMed. You can find it very easily. And so I would like to tell the attendees that you can write your comments or questions if you have any, as we are talking about filler nodules. And nodules that arise as a complications from injectable fillers. So, Dr. Cohen, one thing I want to ask you. This question always comes when I'm talking about complication of fillers, especially nodules. Um, is so is there an increased risk of having filler nodules in the future if we use HA fillers from different brands?
So, that's a fantastic question, and I don't think anybody really knows the answer. There
Mm-hmm.
are, if you look at the regulatory agencies worldwide, there are reports of some filler delayed nodules, and
Mm-hmm.
you actually, characterize that by product. So,
Mm-hmm.
right now, if there's a report, you can actually, access that database and see, what exactly is going on and how frequently the report is. But, we don't know anything about the incidence of this. So, in terms of how many patients got this specific HA and then had this specific reaction. And there's really a barrier to people reporting. So if it's somebody's own patient, they kind of feel like if they report it, then somebody's going to think they did something wrong. And if
Mm-hmm.
it's not your patient and you're taking care of somebody else, and which is often the case, there's many people who are injected in medical spas or in somebody's house or basement or somebody who's not even a licensed, physician. And then when somebody goes to look for them and say, hey, how do you take care of this? If they can even find them, then this person doesn't have any experience and doesn't keep up with the literature and obviously isn't a physician and can't even write a prescription. So, we do see some of these people, and it's not uncommon to see these people. There's been some outbreaks of Mycobacterium abscessans that happened in a New York City hotel room. Toy and Frank published this in Dermatologic Surgery several years ago, where somebody was injecting a non-FDA approved filler.
Mm-hmm.
Actually, filler I don't think was approved in any country, and it had different bovine particles and avian particles. And there were a lot of patients that reacted to this stuff because it
Mm-hmm.
wasn't licensed and wasn't approved, and really probably wasn't meant to be injected in the face or
Mm-hmm.
for human use.
Mm-hmm.
And secondly, they weren't prepping the skin. So, whether they were touching one thing or another,
Mm-hmm.
or the patients, touched the area, they had this outbreak of the mycobacterium. So I think people, buyer beware. It's important that you see a professional, that you see
Mm-hmm.
some medical setting. If it's a core aesthetic physician, dermatologist, plastic surgeon, facial plastic surgeon, oculoplastic surgeon, or aesthetic, aesthetic physician worldwide, these people have more training. They're actually doctors, and they've learned the literature, they've learned anatomy, and they
Mm-hmm.
learn what can go wrong, and they can write a prescription. And they continue with continuing medical education courses to be aware of these things. But certain things just happen, and you scratch yourself and say, why'd you go see this person in a hotel room, or why'd you go to
Mm-hmm.
that person's basement for, a filler party? That doesn't sound like it's a great idea. And now, COVID, people are doing drive-through aesthetics where actually they're staying in their car and just driving up somewhere outside, and somebody's squirting them up. And I mean, if it sounds stupid, it's stupid. I mean, it's just, how do you prep the skin? How do you
Mm-hmm.
history? Who do you call if you're at a drive-through, if you have a problem? So these are real things that we've seen. I've done several articles in New Beauty magazine about this very issue, that the commoditization of many of the procedures right now. People might think of, hey, I want to have Restylane, and they may actually call your office and call my office, and they'll say, how much is Restylane? Well, we don't know
Mm-hmm.
how much you need, so how many syringes, we don't know what it. You're paying for the doctor's time. You're going to get like a half an hour of this person's time, but you're getting their expertise with it. If you called Da Vinci, and said, hey, cook up some drawings, he's using the same pencil that your old daughter is using. You're not going to get the same result. If
Mm-hmm.
if uh, if a Van Gogh was painted with the same paint, I can't paint a Van Gogh, but Van Gogh certainly did. So it's not the paint, it's the painter. And we have to understand that there's a lot that comes with that knowledge and with that artistry and with that expertise.
Mhm. Yeah, I agree with you. It's not only about the syringes, how many syringes that you use, and how much each syringes cost, but it's the expertise that also contributes on the price. And so, if someone asks you, can I, from the aesthetic practitioner, can I use different brand in one person? How would you answer to that?
You know, well, among different brands, there are,
Mm-hmm.
so, in the United States, and I have taught courses worldwide, and I've injected material worldwide,
Mm-hmm.
that something is available in the US yet. But first of all, among brands, there's different products. So,
Mm-hmm.
among the Restylane family of products in the United States, we have Restylane L, Restylane Lift, Restylane
Mm-hmm.
Silk from the Nasha formulations, and then we have Restylane Define, Refine, and Kiss. I
Mm-hmm.
commonly inject all of those Restylane products. Among the RHA line and the Teoxane line, we have RHA
Mm-hmm.
3 and 4, and probably this summer we may have RHA 1. I commonly inject those fillers. And among, Allergan's lines, there's Juvederm Ultra, Ultra Plus, and then Voluma, Bella Velour. So,
Mm-hmm.
I think that many physicians, many practices have a preference for one or two filler lines.
Mm-hmm.
They may not carry all of them, but they
Mm-hmm.
usually have a preference. And that preference can
Mm-hmm.
be their feelings about efficacy, their feelings about safety, or
Mm-hmm.
sometimes it boils down to the patient loyalty programs that
Mm-hmm.
patients like, and they call in and say, hey, I'm part of Allergan's Alley, or I'm part of Aspire, or I do loyalty program, and I want you to carry Bellatero or Bellatero Plus and Radiesse. I think, there's a lot of factors that go into that. But the short answer is yes, we do inject patients with different families of filler.
Mm-hmm.
Who move to Denver, Colorado, where I live all the time. And during all the COVID activity in New York and LA and different parts of the world, many, many, many people moved to Denver this past summer. And I saw patients from wonderful colleagues and friends that were kind enough to send these patients to me. And, even though these patients are sent from friends, I'm not getting all the medical records. Ideally, it would be great to get all the records and see what they've had. And patients, have really had a great experience. I'll see exactly what was done and where it was done, and I'll try to make that a similar sort of scenario by using the same thing. But most of the time, we don't get the records. And for a long time, I've advocated that maybe it's a good idea for patients to have a filler passport to know exactly what they've had and they had it and where they had it. I don't know if that's realistic because I don't think everybody would do it, and I'm not sure everybody would keep it on them or in their phone. But ideally, that would be great.
Yeah, I think in the future it could be applicable, like allergy card, like they bring the allergy card everywhere. But I think yeah, it is applicable. It is a great idea, and I agree with you that there are a lot of other things that could contribute to the inflammatory process that could lead to nodule formation aside than the brands and the HA fillers itself, like the patient themselves, like predisposing factors, and I think like there are all other things that could contribute to the nodule formation aside than the filler brands itself. So there is a question coming from the attendees that is related to a brand as well. So from Dr. Yada Clinic, do you have experience of swelling off and on after injection filler, especially with the CPM technology filler? Dr. Cohen?
So, first of all,
Mm-hmm,
CPM technology, for people who are listening who are not familiar, is the MERS technology of
mm-hmm,
cohesive polydensified matrix.
mm-hmm,
So, when you come up with some new technology, people always come up with some sort of acronym. I don't exactly know what cohesive polydensified matrix means, and I would ask, you if you do, but everybody has their own little area of sort of explaining how these work. But the MERS technology it's a very good filler, Bellatero. We have Bellatero Balance, and then we have
mm-hmm.
Bellatero Plus now in the US that came out about
Okay.
weeks ago, and I've used a bit of it. It just literally came out, and I
Mm-hmm,
got some of that, and it has lidocaine in it. But up until
mm-hmm,
this point, we have not had lidocaine in the Bellatero product. So that is a long story, but nevertheless, I use Bellatero for sometimes infraorbital area. Sometimes I'll use it for fine lines. Sometimes I'll dilute it for the neck and reconstitute it with a higher volume. And it's a very good filler, and it's a very safe filler. There have not been a lot of reports of delayed
mm-hmm,
nodules to that at all. And when you have scenarios like you're actually referring to, like these relapsing delayed nodules, that it sounds like that patient really needs some sort of workup to see what's going on. And
mm-hmm,
I would see if you can actually take a biopsy. So, sometimes if these relapsing issues are occurring, sometimes there's an immune trigger. It may be a vaccine, and the fact that many people get different vaccines, not just COVID vaccine, but shingles and HPV and flu vaccine and various types of things. It may actually see if you can pinpoint the chronology of this.
mm-hmm,
Secondly, we do know that foods can cause swelling. We know that foods cause swelling. Chrissy Teigen
mm-hmm,
actually posted a picture on Instagram this week of actually she had some type of food and she got lip swelling.
mm-hmm,
So there
mm-hmm.
are other things that can stimulate and cause an immune trigger. And through medical detective work, sometimes we're able to actually find that out. So I think that that's important. And then,
Mm-hmm.
from a perspective of, what else you can do, I think a biopsy, when these do happen, becomes really, really helpful. I'll give you a specific scenario. There's
Mm-hmm.
a few patients that I take care of in my community that had a product called Silisex, which is a veterinary grade silicone product. It was never meant for human use. I don't know how this person even got duped, and two people got duped to actually use it. But nevertheless, this person went to a medical spa, and then his friend went to a medical spa. They both got this product called Silisex. I wrote an article in JCAD, Journal of Clinical Aesthetic Dermatology, showing the pictures and the histology. And these were silicone granulomas. So I finally persuaded both patients to let me do a punch biopsy. I did a punch biopsy, and it was literally silicone sludge. And for one of these patients, you know, I've actually seen now for about 14 years, I actually inject every sort of 6 or 8 weeks with some small amount of steroid with a little bit of 5-FU in very focal areas. So that's because it's silicone and we can't make it go away any other way. We just have to live with it. If it wasn't multifocal, I would probably cut it out, but that's not reasonable. Sometimes on the lips, we have to cut it out. But when it comes to HA, if you have relapsing nodules, probably the best thing is to dissolve it with hyaluronidase. So we have different formulations worldwide. In the States, we have Vitrate and Hylenex. Hylenex is a human recombinant, so you don't have to skin test before it. And with Vitrate, you do a little skin test before it, just screening for people who may be allergic to it. And a good litmus test is somebody who's allergic to bees may be more likely to be allergic to hyaluronidase, particularly honeybee or yellow jacket bee, which have a higher amount of hyaluronidase enzyme in their venom.
Yeah. So, according to that, so there's another question coming in as well about using different brands. Oh, okay, so we have discussed about it already. So about using different brands in one part, I think it's more than just the brand, but also other predisposing factors, such as the anything that induce immune reaction can induce formation of nodules or inflammatory reaction on that part, and also the previous filler that the patients use that might not be HA, but other products such as the silicone that you mentioned. So aside than the silicone, so lately there are a lot of collagen stimulator or collagen stimulating fillers that is coming in the market. And what is your opinion about using them together with the HA fillers?
So, you know, I've been using Sculptra, polyl-lactic acid, in combination with HA fillers since 2004. There were 30 that were trained on Sculptra in 2004. We were actually sent to Geneva. I remember the time specifically because my 16-year-old daughter had been born and had some surgery, and when she came out of the hospital, my wife said, you know, you should still honor your commitment and go to this meeting in Geneva. This could be really important for your career. And I said, I feel funny leaving you at home, you know, with this. And she's like, my wife's a pediatrician. And I ended up going to Geneva and had a great experience with Danny Blagar and multiple other doctors. And there's still a picture I have of 30 of us in Geneva in 2004 learning to use Sculptra. You know, and over the years, I think we've learned to use it better. We've learned that this is a biostimulatory filler. We reconstitute it with higher volumes. We not only use it in the face, but there are times to use it in the décolleté. Some people use it, you know, in the hand. These are off-label areas. But it's become extremely common laxity as well as buttock augmentation. So for people who have laxity of their elbows or laxity of their knees or laxity in their buttock area, or they want actual augmentation like you see Brazilian butt lift type stuff with injectables, you know, Sculptra is a wonderful agent to do those things. And it often is used in concert with HA, especially when you're placing face. And that's been fine for many, many years. Similarly, I think Radiesse has gotten a lot of attention lately and doing reconstituted Radiesse for the same type of things. So I commonly will put Radiesse on the jawline. I did the FDA trial for that. I think the data looks fantastic. We just submitted the paper on that about a durable correction in the jawline area for Radiesse, and that's really exciting. We use
Mm-hmm.
Radiesse in the face. We use it in the temporal hollows. It is
Mm-hmm.
FDA cleared in the hands, and we commonly use it in the hands. But as I
Mm-hmm.
said before, there are times where we can hyper-reconstitute it, and we can use it for other things like laxity of the elbow and the knee, and especially the buttock. So for people who have more wavy cellulite, if you put this in between the waviness at the bottom part of that, so there's peaks and then there's naders. If you inject that Radiesse into the area, you're going to lift that area up. And I did a segment on my videocast called Scientifically Speaking with several docs talking about how we combine different cellulite treatments. And I think it's really exciting where we are in the US right now with cellulite specifically, because Quo, which is a collagenase, got FDA approved, and we're starting to use it now. I did the FDA study a couple years
Mm-hmm.
ago, and I'm faculty in the Quo East Coast and West Coast course that's coming up. And I've published as the lead author some cellulite scales. And I think we're going to be seeing a lot of attention on cellulite with this injectable Quo. But that's just for dimples, right? So that's just for dimples. You need something else to address waviness. And
Mm-hmm.
that's where the reconstituted Radiesse comes into play. In
Mm-hmm.
addition, Soliton got FDA approved last week. This is an acoustic type of way to use acoustic waves to
Mm-hmm.
break up some of those fibrous bands that pull down in the septae of cellulite. And that actually has been found to be effective in dimples. And I've seen
Mm-hmm.
a lot of pictures where it can more globally improve cellulite as well. And I think where the dust is going to settle, and if we do this same conversation, and I'd love to at different intervals of time, but if we do this in a year, I think we're going to be using Quo for the dimples or Sulfina, which I did some of the tests for, and we'll use dilute Radiesse for the sort of the valleys in these
Mm-hmm.
areas, and then we'll use Soliton for sort of that more global appearance. And
Mm-hmm.
combination therapy, whether it's on the buttock for cellulite or it's on the face, for photoaging and age-related changes, is really what our practices are made of.
Mm-hmm. Mm-hmm. Yeah, so I think using different kind of fillers is reasonable. So we don't have to be afraid of like the complications like filler nodules that could be arising from the from using those different types of fillers.
I want to go back to your question about, using HA fillers with other fillers. So not only
Mm-hmm.
did I have my experience with many, many years of Sculptra or using
Mm-hmm.
radiation, but I will point out that 2 weeks ago, Allergan
Mm-hmm.
acquired an Israeli company that actually has a filler that is HA and calcium hydroxylapatite together.
Okay.
So it's very interesting, and we know these things are compatible for years of use. And Allergan, has had the foresight to purchase this company and develop their filler line as well.
Okay, that is very interesting. I just know that from you about the combination because there are like opinions about not using other collagen stimulator together with the HA fillers. There are some opinions about that, and I am very glad that you come up with new insights and different insights and introduce us with new products from the allergen.
So, I will point out that when we're talking
Uh-huh.
about that example is HA with calcium hydroxylapatite.
Hmm.
There was a bit of a trend for a little while for more in Europe than the US, but some people were actually mixing in the same syringe some
Hmm.
Botox, some HA filler, or some
Yeah.
Dysport and some Restylane. So I'm not an advocate of that. I actually wrote an editorial in Drugs and Dermatology because I like to use things really precisely. So, I think when you're using Dysport or Xeomin or Botox or Jeuveau, it's a very precise injection.
Hmm.
It's not horseshoes where close is good enough. We want to actually get to the area of the muscle that we want to inject. If somebody
Hmm.
has, a lot of orbicularis oculi muscle pulling down
Hmm.
in this
Hmm.
area, I want to precisely hit this area so I stop it from pulling down, and I give them a brow lift, right?
Uh-huh.
I don't want to make it not precise and hit a little bit of frontalis and then tell them I'm going to give them a brow lift, but not give them a brow lift because I hit some fibers from an adjacent muscle. And by the same token, there's people who you come in and they say, hey, I just have these scrunchy lines here. Can you go down a little bit lower with the Dysport because I don't like this area? No, you can't, because you could actually hit the
It's like,
zygomaticus minor and
mm-hmm,
major, and it's going
mm-hmm.
to make the patient look like they had a stroke.
Yeah.
So, but I do put filler there all the time. If that patient
Mm-hmm.
is wanting more toxin, I'll say, no, we can
Mm-hmm.
actually create a strut over the cheekbone to lift the skin away from the
Mm-hmm.
underlying. So the way I approach these things is very, very clear. I just tell them, I don't want to put it in the same syringe because I actually want to be precise. And for my,
Mm-hmm.
I want to precisely target the muscle that's causing the pulling down or the pulling up that
Mm-hmm.
we want to neutralize. And for the filler, I want to create and structurally build up some area to really support that. And I don't want the muscle to be affected there.
Mm-hmm, mm-hmm. Okay, that is good insight. Yeah, we know that a lot of practitioners actually mix toxins and fillers, especially from what I know from sharing from other doctors. They use it for I don't know if you're familiar with this or not. So for
Quality.
we call it mesobotox,
Yep.
like using like small concentration of toxins and mix it with HA, so it could give what would say in like moisturizing effect, something like that.
Talking about this meso Botox and meso filler for a decade. I first learned about it at IMCAT probably
Uh-huh.
I don't know, maybe 12 years ago, and then MWC in Monaco and other
Mm-hmm.
places. I think that's different than what I was talking about. So
Mm-hmm. Mm-hmm.
a lot of excitement about doing things that people use for quote hydration. So
Mm-hmm.
people are actually injecting things, or in our practice, we might do that with aqua gold. So
Yeah.
we'll Restylane, we'll put it into the receptacle for aqua gold, and we'll stamp on an area. And that's very different than what I was referring to. Some people
Mm-hmm.
actually, the aqua gold stamping for sprinkles of toxin in the forehead, and
Mm-hmm.
people have actually done that. It's been found to, with the fillers, the skin quality can be improved. People are getting like little tiny aliquots of filler that bind water, and that hydration makes the skin look better. And then from a toxin perspective, there's been studies. Shaw published a study on the forehead about attenuating the little pores. So if people don't like the way they
Mm-hmm.
look in their face, you can shrink their pores
Mm-hmm.
temporarily. And what that's been found to do is not only decrease the pore size, but decrease the sebaceous output.
Mm-hmm. Mm-hmm.
They look kind of less glistening to that.
Mm-hmm.
I think all these are interesting. We use it, and I use it all the time for hyperhidrosis. If I'm
Mm-hmm.
precisely going after a muscle, as I was referring to, trying to get a,
Mm-hmm.
or I'm precisely going after building up area of the cheek, then I don't do it. I actually just focus on what needs to be done, whether it's the
Okay.
fill here or the
Or
toxin.
toxins. Okay. Okay. So we talk for almost an hour now about there are a lot of things that can be discussed with you. And I remember that on the virtual MWC, you gave like 3 lectures. I wish that it was not virtual because I would have met you already if we can like have it offline. So thank you very much as we are approaching the end of the Instagram Live, Dr. Cohen, for your time, for your expertise, and for your great insights and experience. It is very, very insightful and about because there are a lot of opinions about using fillers, not to use a different brands, not to use different type of fillers because it could induce granulomatory granulomatous process. However, as as we have heard Dr. Cohen explain to us, that it is not only the filler itself, but also the predisposing factors or the background of the patient's conditions, what the patients had earlier. Either it is infections, either it is vaccines, either it is other things that could induce immunologic reactions, could induce nodule formations. Uh, am I saying it right, Dr. Cohen?
Yes.
Anything else you want to add to it?
Yeah, I would love to come back and talk to you about laser resurfacing and, even using energy-based devices and
Mm-hmm.
archetypes, because I think there's been really a lot of exciting developments. And, sometimes when patients ask you questions, you know,
Uh-huh.
they say oftentimes, how long does a filler last? Well, that's a
Mm-hmm.
complicated, is it a 1 grade improvement, 2 grade improvement? Is it a return to baseline?
Mm-hmm.
How long are patients happy with it? Typically, we're doing combination therapy. So we're doing lasers or peels or other types of devices, as well. And they're not just going to be looking at their filler overall results. They're going to be looking at the whole sort of
Mm-hmm.
package. Combination
Mm-hmm.
therapy, as I alluded to, for cellulite or in the face, and using energy-based devices are really helpful to think of sort of as we combine these different modalities for people. And I'd love to come back and talk to you.
Okay, thank you very much. So AMWC Asia Pacific. So we hear that Dr. Cohen would really love to share his expertise and knowledge about other things, including laser resurfacing and combination treatments, also with treatments for cellulite. And we are looking forward to it. And I am very happy and eager if I could like discuss with you again about those topics, especially about laser resurfacing, because we know that in my country, where we have skin Fitzpatrick skin type 4 to 5. It is a little bit uh, tricky, like difficult to not to induce post-inflammatory hyperpigmentation in our patients, especially like the sun is like shining throughout the year.
Even, even like hair removal,
Hmm.
patients with darker skin, type 4, 5, or 6, they don't realize that an option for better, safer, more effective hair removal devices are out there. And we have a product called the Cocoon Prime Lace in our
Hmm.
practice.
Hmm.
4 different wavelengths that you can selectively try: A10 diode, 755 Alex, 940, and 1060. So you can actually use this and use a blend of different wavelengths on darker skin types. And we've seen some really fantastic results. So I'm happy to come back and talk about it.
Okay, okay, I'm looking forward to it. AMWC Asia Pacific, please note it down because Dr. Cohen is very eager to share about new technologies coming in aesthetic dermatology. Thank you very much, Dr. Cohen, for your time and everything that is like very insightful for us. And thank you, MWC Asia Pacific and Euromedicom, and also Multi-Specialty Society for arranging this for us. Even though this is online and I cannot see you directly, but I'm very happy that we can be connected via Instagram Live. Thank you very much for all the attendees. Good night, good morning, good afternoon, and good evening, wherever you are. And see you again very soon, Dr. Cohen. Have a nice day.
You know, I have
Bye-bye.
a pleasure to
See
work with
you.
you.